All right, it's now. Now is your chance to get health care for next year. Open enrollment for the Affordable Care Act Marketplace healthcare plans is going on right now. So is Medicare enrollment. We know that you have questions, and we have experts to help you navigate the process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They're all here to answer your questions, and this is how you get your questions to our experts. The number is 336-379-5775. These are text-only questions. Please don't call, but please do text in your question. All right, first and foremost, let's just go over the fact that the enrollment is open for ACA and Medicare. I think we've got a calendar that we can put up so that we can show those dates and make sure that everyone knows that it's open right now, but there are end dates to this. So for Medicare, Catherine, when can they enroll until?
Till December 7th.
All right, so you got until December 7th to do that. Healthcare.gov. There's actually two deadlines there, Laura. Let's tackle the first one.
Well, if you want coverage on January 1st, you need to sign up by December 15th, but you have until January 15th to sign up for next year. It just won't start right away.
All right, let's put that calendar up as well, because we have a calendar that shows those two deadlines for healthcare.gov, and that is so that you can be very clear on when you want your coverage to start. So if you sign up by December the 15th, that's the number one, that means that you are going to have coverage starting January 1st. But if you don't sign up until January 15th, you are not going to have coverage until February. All right, now that we've got all that going on, Morgan, let's talk about how this year there are a whole lot more providers out there.
Yes, so we have had a lot of new carriers come into North Carolina, some in different counties. So it's not the typical just Blue Cross and Blue Shield. We have United Healthcare, we have Cigna, we have Ambetter, we have Friday, and I'm sure there's some more that I'm leaving out. What I would caution you for is when you're looking at your application on healthcare.gov and you have all of your plan selections, please check your network. If you are a Novant person and that's where you like to go, and you enroll in a plan that they do not have Novant in their network, you're not going to be satisfied with that plan. Please double check your networks.
So when we go onto the marketplace, maybe you can kind of walk us through that, and we're looking at the different plans. Does it list it right there so that we'll know?
Yes, so when you finally complete your application and you're at the final phase where you select your plans, you may be a little bit overwhelmed. There are some counties that have up to 84 different plans for you to choose from. Pay attention to the deductibles, the copays, and there's a nifty little button there that you can click and you can check. It'll route you over to the carrier's website where you can look up each individual doctor that you go to.
All right, and that sounds like an arduous type of task, right? It does, but you don't want to pick the wrong one. Otherwise, you're going to be really upset if you can't go see your regular doctor. Okay, so a lot of the plans, you might be overwhelmed and thinking, oh my gosh, there's no way I'm going to be able to afford these. But Laura, you had a stat the other day that talked about the amount of plans that were really affordable.
Yes, according to CMS, 4 out of 5 people can find a plan for $10 or less a month. So even if you've looked in the past and it's been too expensive, thanks to the American Rescue Plan, it's cheaper than ever. So definitely go to healthcare.gov and check out your options.
All right, so with that said, this person just texted in and said, I've done the Affordable Care Act 3 times this year and last. I live in Guilford County, but it's only giving me options of paying $700 and I'm unemployed. So can we give any thoughts on that of what they should be doing and maybe where they should be looking instead?
If that person was in their application and they did not select the income correctly and they did not list like if they got unemployment or what they had made if they had worked throughout the year, that could throw off the application. And then there's this one tiny question that a lot of people seem to skip. Does your employer offer health coverage? Some people do not read that question and they automatically check that box. When you check that box, it throws off your entire application and you do not get a tax credit.
Aha, okay, so there's a box that says, does your employer offer health care? And you have to either check yes or no.
Correct.
Okay, make sure you are doing that. All right, we have a couple of Medicare questions here. First and foremost, Catherine, this person is asking, is the Medicare cash card for $2,800 real? I'm thinking that that does not sound right.
That does not sound right.
Okay, so that sounds like some kind of scam that someone is trying to tell you that there is something out there that that's a thing, and that is not a thing. Okay, this person is asking, I turned 65 in August. Do I enroll now, or do I wait until the 6 months before I turn 65?
You have to wait until 3 months before your birthday to enroll. You have 3 months before the month of your birthday and 3 months afterwards. So back it up from there and put it on your calendar. But in the meantime, start thinking about how and what kind of supplemental policies you might need in addition to that.
Supplemental policies like
for prescription drug prices, for the parts of Medicare that are not covered by Medicare per se, that 20% that is not covered by them. So
Go ahead, I'm sorry.
either if you're still employed, there are several options that way, but if you're not, you need to start exploring that so that you can get those answers as you get ready to enroll.
All right, and every time we get to the Medicare question, let's talk about Part B. What do you have to do, Morgan?
You need to enroll in Part B if you do not have credible coverage deemed through your HR that it is good as or better than Medicare coverage.
Okay, so you do have to apply for it, and then you can say, I'm going to wait on it.
You can waive it, yes.
Okay, but you have to apply for it then, because if you don't, you will be paying a penalty for the rest of your life. Okay, we've got lots of text questions. We're coming back. We're taking a quick break. We'll be right back. Welcome back. We are getting your healthcare enrollment questions answered with Morgan Campbell, Laura Packard, and Catherine Sevier. Let's talk about this. Someone is asking, how much income do I need to qualify for the ACA healthcare plans?
If you are a single person and your household consists of just you, you would actually need $12,880 to qualify.
Okay. This person is asking, why did my insurance go up for next year, Laura?
Well, it sounds like his or her insurance company mailed an auto renew letter. And so what you should do is go to healthcare.gov, make sure your income is correctly entered so that it reflects, the most current numbers, and check your policies, because whatever you're auto renewed to may not be the best, cheapest, most affordable policy. So look through your options and don't auto renew.
Catherine, this person's saying, what is the donut hole concerning prescription drugs for Medicare, and do all insurance vendors have this?
Yes, all insurance vendors have it. The donut hole is a dollar amount that once you have hit that, you pay for the drugs, and then after that, you hit a catastrophic and everything is picked up afterwards. But it's fortunately going to go away in future years, but right now there's still a donut hole there.
So it's kind of like a deductible kind of thing?
It is. It starts out that Medicare pays for the drugs, then you hit the donut hole, you pay, and then when you hit the higher level, then Medicare picks up again. It's one of the reasons that you really need to look about having a prescription drug plan so that you can manage all of that pricing and keep your costs down to a minimum.
All right, and so as you're enrolling in Medicare, that is one of your options, is to get a prescription plan. Okay.
And one way is it's called Part D, but many of the supplemental plans also have a prescription drug plan with them where you would get your Part D coverage that way.
Okay. This person says, I received Social Security, and as a retired North Carolina state employee, I received the insurance offered by the state. I've been very satisfied with these plans. Is there anything else I should do?
No, you have a retirement benefit.
So this is all good.
This is all good stuff right there.
Okay. All right. This person is saying, why would someone want a Medicare supplement plan versus a Medicare Advantage plan?
Depends. There's a number of reasons you would want to make a decision of whether you want to be in a Medicare Advantage plan versus traditional Medicare. Traditional Medicare is what most of us know of as Part A, which is your hospital coverage, Part B, which is your physician and your outpatient coverage. And then we were just talking about a prescription drug plan. A Medicare Advantage plan is a managed plan where all of that is rolled into one set of pricing, and some of the benefit of that is that it will have other things attached to it, often like eyeglasses, dental, hearing aids, those kinds of things. But you may not be in a community where your physician is in that plan, or where the deductibles work out for you. So you want to shop it based on where you live, who your physician is, and what your needs are.
Gotcha. Okay. All right. Let's talk about healthcare overall, Laura. Right now, things are going on in D.C. What can you tell us latest?
Well, things have been going on for the past few months now. Congress is working on a bill. You may have heard it called budget reconciliation or Build Back Better. But this bill has multiple pieces that will affect your health care potentially. First, it makes the ACA subsidies that were in the American Rescue Plan last until 2025. So if you get your health insurance through the Affordable Care Act, it will keep your rates cheaper, at least through 2025. Second, it fills the Medicaid gap. So in states like North Carolina that didn't expand Medicaid to low-income people, Morgan mentioned earlier, you had to make a certain amount of money to qualify for an ACA plan. And so if you don't make that much money, right now you probably don't qualify for anything. And if this goes through, then you would qualify for a $0 plan through the ACA exchange. Also, there's going to be a Medicare drug price negotiation and a cap on insulin at $35 a month. So if you have Medicare, it may lower your prescription costs. And even if you don't have Medicare, if you are a diabetic and you rely on insulin, it should lower your insulin costs too.
All right, so we'll see what happens with that legislation and see what comes out of that. This person is asking, is there any way to filter results for plans if you get too many to review? And we were talking about how it is kind of overwhelming.
Not really. You just have to do your due diligence and scroll through and scroll through and scroll through a little bit more.
Okay, so here's a way that you can help with that, and that is to talk to an insurance broker, because they can actually look through that and they kind of know some of the plans that you need to have. And Morgan, that is something that you do, and you make a point saying if they ask you for a fee to walk out or hang up the phone.
Correct.
Okay, and Laura, you had a tidbit about something to make sure when you go to an insurance broker to ask about.
Make sure that they're not going to charge you anything, and also that your plan is an Affordable Care Act plan, that it has all of the essential health benefits. If they're talking to you about a short-term plan, it may be cheaper, but it may not cover you when you really need it.
Okay, all right. We've got to take a quick break. We're going to be back with our last segment and your text questions next. All right, we're getting your healthcare questions answered with Morgan Campbell, Laura Packard, and Catherine Sevier. This question is, are the insurance companies you see on TV legitimate? Can you really get your Medicare premium of $144 back if you qualify?
So here in North Carolina, in certain counties, we do have insurance carriers that are Medicare Advantage plans, and they have what's called a Part B premium give back. When you are reviewing those plans, you can get that. Read the guts of the policy. There may be a stipulation in there that says you have a $500 deductible or $1,000 deductible that's built into that plan. So just caution, yes, they are out there. just read the policy and make sure you understand it completely.
Yeah, lots of fine print there. All right, this person says, I'm a 100% disabled veteran and I get everything from the VA. Do I still need to enroll for Medicare benefits? And do I still need to have money taken out of my account for Medicare? Catherine?
Yes, you do. If you're disabled, there's a good chance that your premium will be very different because of your disability, but you do need to be enrolled. And it's likely at some point that you will get some of your services that the VA may contract for from the community. So you definitely need to enroll.
All right. Hey, Laura, one more time. Let's talk about those deadlines so people know. You were saying, I know the deadline's far away, but you should do some window shopping.
Yes, because I'm in this situation. I need to figure out which insurance plan I want for next year, which ones cover my doctors. So now is a good time to go to the marketplace, see what's available in your county, and start digging in to figure out which insurance your doctors take. Because it's better to do this kind of exploration and thinking not at 11:59 p.m.
Right, on that deadline day. Okay. They're saying, you said find an insurance rep. What do I look for Medicare insurance? What are the helps and resources there, Catherine?
Well, people like Morgan are certainly available to help with that. If you just need more information that you want to go it on your own, go to Medicare.gov and read about insurance in North Carolina. Be sure to put your zip code in and start there. We also have a program in North Carolina called SHIP, SHIIP, and they can help you as well.
Yeah, 2 eyes in there. We're going to put that in the 2 wants to know section as well. This person says, my grandson is unemployed, got his health insurance last year through the marketplace. It was really expensive. It seems like there's no help if you're unemployed for cheaper insurance. Morgan?
So there is an option out there. They are called catastrophic plans. They do meet all the ACA requirements. Basically, it has a higher deductible and it'll give you 3 sick visits a year and still cover all of your preventative care at 100%. So that might be an option that they want to check into. Or like Laura had mentioned earlier, we do have other policies that are called short-term medical plans that could possibly fit that need.
Okay.
And also pay attention to what Congress is doing right now, because if they do pass this bill, that would help people that don't have a source of income and need health insurance in North Carolina.
Right, and so again, while the deadline is looming, you still have some time to see what's happening with this legislation to see if it might be able to help you out. All right, we will see all of you again in December as we continue to go towards this deadline. Thank you for your time and your expertise. If you missed anything, we want you to be able to get all of the resources, SHIP, AARP, Get America Covered, Alliance Insurance Services. It's all in the 2 Wants to Know section.